Okay, good afternoon, class. So, welcome back again. We are going to look at adverse drug reactions. We said adverse drugs reactions are noxious unintended effects that occur at normal drug doses. Noxious means something poisonous. They are unintended, and they occur at the normal drug doses. So we have given the right dose, but already there are unintended effects occurring. This is what we mean by adverse drug reactions. They range from mild, such as drowsiness, someone can become drowsy, or there is itching, pruritus, or there has been a rash after administering a drug. We say these are mild, but we can have a severe form and also the potentially life-threatening conditions, okay, like depression or liver injury or anaphylaxis, like anaphylactic shock, and even cardiac dysrhythmias, meaning alternation in the heart rhythm, the heartbeat changes and, and the rhythm is altered. So adverse drug reactions can affect all body systems and are influenced by risk factors such as age, the elderly and the very young, and then those with severe illnesses. But also concurrent use of multiple drugs can cause adverse drug reactions. The incidence of ADRS is on the rise, according to data, and this one has led to significant healthcare burdens. For example, this is an extract taken from Canada. They said approximately 80, this is a data from Canada, approximately 80,000 people visit emergency departments each year due to effect of adverse drug reactions. Another one in the US, this data is saying about 1.735 million people are hospitalized. Patients experience serious adverse drug reactions resulting in actual over up to 3,800 deaths annually. So this is quite a lot. People dying from adverse drug reactions when it wasn't intended. Okay, it wasn't intended, but it is happening. So actually, that means we really need to express max caution. Otherwise, already someone is dying from a treatment which should have not killed him. So many ADRs are preventable, making it essential to understand the types and contributing factors. Now let's look at the types of ADRS. We look at allergic reactions. And then we have what we call idiosyncratic effects, and we also have paradoxical effects. So allergic reactions occurs in less than 10% of cases involving an immune system response triggered by prior sensitization from an initial exposure to the drug. And then re-exposure leads to allergic response ranging from mild itch and severe rash to life-threatening anaphylaxis. So these allergic reactions normally is an immune response, okay, to an external agent triggered uh, after after sensitizing someone with a medication, after being sensitized with an injection. It can be an oral medication or even having contact with an irritant. Okay. So what happened here is that already there is a memory. The body already has those memory cells, so that re-exposure to this same allergen causes a wide-ranging kind of responses that can be life-threatening, especially the anaphylactic shock, which happens. We might be knowing that penicillin is one of those drugs that we know people always have some allergy to. They say some literature say 95% of the world population is non-allergic to penicillin, but there is that 5% proportion that is always allergic to penicillin. So that's why we also need to ask about history of allergy and all those kind of things, because it's one way we can be able to prevent this. The next one is the idiosyncratic effects. These are uncommon drug response arising from genetic predisposition. So they are really not common to the general population, but they happen in specific people because of our genetic variabilities. They are genetically predisposed, okay, leading to unexpected reaction. The example we have here is hemolytic anemia with aspirin. Okay, somebody is given aspirin and then is developing hemolytic anemia. Or somebody is given any sulfur drug, those sulfonamide drugs, antibiotics, and then develops these effects. And this is common with people with the deficiency of this enzyme. That's what we call glucose 6 phosphate dehydrogenase, glucose 6 phosphate dehydrogenase. deficiency. This is an enzyme that might be lacking in some it's a metabolic disease. Actually, it's a metabolic disease, and some people with this particular enzyme deficiency will always have problem when you administer them sulfur drugs. Okay, they will have adverse reactions. We have paradoxical effects. It is the opposite of the intended or expected response. Okay, such as when your dietafine is a sedative and then causing an excitement or insomnia instead of sedation. So they say sometimes the intended purpose for giving a drug uh, becomes the opposite. What we see in the patient becomes the opposite of what we are intending to see. For example, somebody is like getting agitated and is vigorously uh, difficult to control, and we said this person we need to sedate him because maybe he's getting out of his mind and is running here and there. And so the best way is we give this person a sedative like a diazepam, and we know that what diazepam will do is this person will it will relax the muscles, and this person will have some rest. It is hypnotic. It induces sleeping. But instead, in some people, what might happen is that we are giving a sedative with the aim of seeing that effect to see the person becomes calm and maybe sleeps. Instead, it causes the opposite excitement or even lack of sleep. Insomnia means lack of sleep. Okay, so this is what we call paradoxical effects. Sometimes they happen with certain drugs and also with certain people. We have iatrogenic diseases. Iatrogenic diseases with adverse effects produced by healthcare professionals or drugs. So something iatrogenic is induced by healthcare professional or induced because of giving another drug to a person. Okay, all this can happen. Carcinogen means cancerous. Certain medication or chemicals can cause cancers. Anti-cancer drugs, ironically, can be some of the most carcinogenic drugs. Teratogenic, we should be knowing about teratogenic drugs already. These are drugs that induce bad defects, exemplified by isotretinoin and thalidomide. So interesting, at your free time, you might read about the thalidomide incident, which was the best known teratogenic drug that ever happened in the history of pharmacy, where this drug was just produced in the 1960s or I mean 60s 70s, and the drug was intended for use by pregnant mothers who were complaining a lot about morning sickness. Pregnant mothers in the first trimester always complain a lot about morning sickness, drowsiness, feeling nausea, vomiting, all those kind of things. And this drug was said to have an impact in minimizing those symptoms. At the end, it was realized actually this drug has impact on the growth of the long bones. So what happened is that most of the women who took this drug within that age gave birth to children without long bones. So a child is born without legs, a child is born without arms because this drug acts on the long bones and makes them not to grow. Okay, and it became one of the biggest disaster that ever happened. So you might read about it at your own time. It's interesting and it's good to know. Okay, minimizing adverse drug reaction. We said in the pharmaceutical industry, we can focus on producing safer medicines. Whereas the prescribers choose the least harmful drugs based on patient characteristics and the medical history. Our nurses and the patients should be aware of the adverse drug reaction associated with the prescribed drug, and we always have to tell the patient so that they know and they can be able to adhere and take to the lasting dosage. Otherwise, sometimes they stop on the way because we have not told them the expected adverse reactions that might happen. Nursing evaluation, so we regularly assess patients for ADRS and provide education about their recognition and management. Vigilance, patients and their families should always be vigilant about ADR signs and symptoms. Okay, and then they should be able to seek immediate medical attention in case if it arises. So all this need to be taken into account. We also look at organ function monitoring. We could regularly monitor the function of target organs such as the liver, kidneys, and bone marrow through appropriate tests. We can also do individualized therapy. We balance the potential risk versus the benefits, especially in patients with chronic disorders that requires long-term drug treatment. Medication errors. Let's look at medication errors. By definition, we say medication errors are preventable events that may cause or lead to inappropriate drug use or patient harm while the medication is under the control of the healthcare professionals, patients, or consumers. So actually, these errors can arise right from the doctors or for us, the ones in the prescribing roles, or it can be because the patient did not listen well or is not educated enough and did not understand how to take these particular drugs. Okay. Uh, some records here also about prevent said medication errors injure approximately 150,000. These are data in Canada, and also led to an estimated 100 deaths annually. So you see, just errors. I mean, 700 people die annually just in Canada just because of these particular errors. I wish we could have some data for South Sudan and see perhaps it could be more than this. Looking at our setup and the human resource challenges we have. The treatment of drug-related injuries costs about 35 billion each year among hospitalized patients. So we have types of medication errors. It could be because we gave this drug to the wrong person, or it could be because the dosage was omitted, or the person was given the wrong drug. It can also result from wrong dosage form. It can also be from wrong route of administration. Some drugs are given IV. Others cannot be given IV. If this is a drug that's given IM and it's already given IV, you might have already seen some reactions that we were not expected. Okay, some drugs need a diluent is something a chemical constant that we use for diluting a drug. So if you use the wrong diluent for this particular drug, sometimes you expect already a vigorous reaction within this drug, and by the moment it's administered, it's already a different scenario all in the body. Also, wrong timing, wrong strength or concentration of the drug, and also wrong dose. All these are different types of medication errors that arise. We are still continuing. Wrong infusion rates. Okay, over infusion. Okay, sometimes this happens. We are giving IV fluids and then it goes over, and you see somebody has fluid overload. Okay, fluid overload and even goes into heart failure because of overload. Overdose, underdose, extra dosage, wrong technique, including inappropriate crossing of tablets, deteriorated drug error, dispensing expired drugs, all this wrong duration of treatment, continuing too long or stopping too soon. All these are really errors that can lead to all those. Uh, Still continuing with causes of medication errors, we have the human factors. We look at performance, knowledge deficit, miscalculation of dosages, drug preparation errors, stress, fatigue, and lack of sleep. Okay, all these can lead to human errors. Communication, written and oral miscommunication. Okay, poor handwriting. You will have seen that also. There is data on uh, bad handwriting of doctors causing many deaths because the nurse might have not understood what the doctor had written, and then the person is given a wrong drug because of poor handwriting. Or again, the oral communication between the patient and the clinician prescribing, or the nurse giving, was not properly understood, and then errors happen at home. Name confusion, okay, trade name confuse and generic names confuse. So this is one of the challenge. Always many manufacturers, drugs will come to the market with different manufacturers' trade names, but always generic names. Sometimes our basis of unification, but the problem is that the patients normally always knows better the trade name, and they always move with these drug boxes that I just want this particular drug. So all this kind of confusion can cause a lot of errors. Computer errors, okay, technology related issues. can still impact through our records. Stocking errors, mistakes in medication storage and retrieval, transcription errors, errors during the transfer of the prescription detail. So in conclusion, we said adverse drug reactions can range from mild to severe and they are a significant health concern. Medication errors pose a serious risk to patient safety and well-being. By understanding the types and causes of ADRs and medication errors, healthcare professionals can work together to minimize harm and improve patient outcomes. With this, we have come to the end of this lecture. Thank you for being with me.